Tuberculosis, TB, is a highly contagious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs but can also impact other parts of the body, including the kidneys, spine, and brain. TB spreads through the air when an infected person coughs, sneezes, or talks, releasing tiny droplets containing the bacteria. Globally, TB remains a significant public health challenge, particularly in developing countries where healthcare access is limited. The disease is characterized by symptoms such as persistent cough, fever, night sweats, weight loss, and fatigue. Despite its prevalence, TB is preventable and treatable. The standard treatment regimen for active TB typically involves a combination of antibiotics taken for 6 to 9 months. This approach aims to eliminate the bacteria from the body and prevent the development of drug-resistant strains. The first line of treatment usually includes 4 medications: isoniazid, rifampicin, ethambutol, and pyrazinamide. These drugs work synergistically to combat the bacteria, ensuring a higher success rate for treatment. To manage TB effectively, adherence to the treatment regimen is crucial. Patients often face challenges in completing the full course of antibiotics due to side effects, the lengthy duration of treatment, or a lack of understanding about the importance of completing the therapy. Directly observed treatment, short course, DOTS, is a strategy implemented in many regions to address this issue. It involves healthcare workers supervising patients while they take their medication, enhancing adherence and reducing the likelihood of drug resistance. In cases of drug-resistant TB, treatment becomes more complex and prolonged, often requiring second-line medications that can be less effective and more toxic. Multi-drug-resistant TB, MDR-TB, is particularly concerning, as it does not respond to the most effective first-line drugs. Treating MDR-TB typically involves a regimen of 5 to 7 drugs over an extended period, which can last from 18 months to several years. The emotional and financial toll on patients and their families can be significant, highlighting the need for comprehensive support systems to aid recovery. Preventing TB is as important as treating it. Vaccination with the Bacillus calmette-guerin (BCG) vaccine provides some protection, particularly in children, although it is not universally effective. Public health initiatives that promote awareness, improve living conditions, and ensure access to healthcare are vital in reducing TB transmission. In many countries, screening high-risk populations, such as those living with HIV, AIDS or in crowded conditions, is essential for early detection and treatment, ultimately controlling the spread of the disease. The global effort to combat TB also involves research and innovation to develop new diagnostics, treatments, and vaccines. Advances in molecular diagnostics have led to faster identification of TB and its drug-resistant forms, enabling timely and appropriate treatment. Ongoing research is focused on discovering new medications that can shorten the treatment duration and improve outcomes. Collaborative efforts among governments, healthcare organizations, and researchers are essential in the fight against tuberculosis, aiming to eliminate the disease as a public health threat and improve the quality of life for those affected. In conclusion, tuberculosis is a manageable disease with the right strategies in place for prevention, treatment, and support. As the world continues to grapple with TB, the commitment to advancing medical research, improving healthcare access, and fostering awareness remains vital in overcoming this public health challenge. The successful control of TB is achievable through concerted efforts at individual, community, and global levels, emphasizing the importance of collaboration in combating this ancient yet still relevant disease. Tuberculosis, TB, remains a complex and multifaceted disease that poses significant challenges to public health worldwide. As we delve deeper into its aspects, we uncover layers of complexity involving its biology, transmission, treatment hurdles, social determinants, and innovative approaches to eradication. Understanding these factors is crucial for developing effective strategies to combat TB and ultimately achieve its elimination as a public health threat. The bacterium Mycobacterium tuberculosis is known for its unique characteristics, including a thick, waxy cell wall that makes it resilient against many antibiotics. This structural feature allows it to survive within the human body, often evading the immune system. Once inhaled, the bacteria can settle in the lungs, where they can lie dormant for years, a state known as latent TB infection, LTBI. Individuals with LTBI show no symptoms and are not contagious, yet they remain at risk of developing active TB later in life, especially if their immune system becomes compromised. Factors such as malnutrition, diabetes, and co-infection with HIV significantly increase the risk of latent TB progressing to active disease, illustrating the interplay between TB and other health conditions. The treatment of TB has evolved over the years, yet it remains a prolonged and rigorous process. The standard regimen, lasting 6 to 9 months, can be challenging for patients due to the side effects associated with the medications, which may include nausea, fatigue, and liver toxicity. Patients must remain committed to the treatment course, and any missed doses can lead to drug resistance, complicating the already intricate landscape of TB treatment. Additionally, the emergence of extensively drug-resistant TB, XDR-TB, presents another hurdle, requiring even more complex regimens that may include second-line drugs with significant side effects. This situation underscores the need for patient education and support systems to ensure adherence and minimize the potential for resistance. Socioeconomic factors play a significant role in the TB epidemic. People living in poverty often reside in crowded and poorly ventilated environments, facilitating the spread of the disease. Access to healthcare services is another critical determinant. Individuals in low-income regions may lack the resources to seek timely diagnosis and treatment, further exacerbating the cycle of transmission. Stigmatization surrounding TB can also hinder individuals from seeking help, fearing discrimination or ostracization from their communities. Addressing these social determinants of health is essential for effective TB control, requiring a multifaceted approach that encompasses not just medical interventions but also social support, education, and advocacy. Innovative approaches to TB control are emerging as researchers and public health officials seek to develop new strategies for prevention and treatment. The advent of molecular diagnostics has revolutionized TB testing, enabling rapid detection of both TB and drug-resistant strains. These technologies allow for timely intervention, significantly reducing the time to diagnosis from weeks to mere hours. Furthermore, ongoing research into novel vaccines holds promise for enhancing prevention efforts, particularly among high-risk populations. Several candidates are currently in clinical trials, with the hope of providing broader protection against TB than the existing BCG vaccine, which is only partially effective. Global efforts to combat TB have intensified, especially with the World Health Organization, WHO, declaring the disease a global health emergency. The End TB strategy aims to reduce TB incidence by 90% and deaths by 95% by 2035, emphasizing the need for integrated healthcare services, increased funding for research, and community engagement. Collaborative efforts among governments, non-governmental organizations, and communities are critical for achieving these ambitious goals. Public awareness campaigns that educate populations about TB, its symptoms, and the importance of early diagnosis can empower individuals to take charge of their health and seek timely medical attention. In conclusion, while tuberculosis remains a formidable public health challenge, understanding its complexities provides a pathway to effective solutions. By addressing the biological, social, and economic factors surrounding TB, and by harnessing innovative technologies and collaborative efforts, the global community can make significant strides toward eliminating this ancient disease. Continued commitment to research, education, and patient-centered care will be essential in transforming the landscape of TB treatment and prevention, ultimately safeguarding future generations from its impact. Tuberculosis, TB, continues to be a significant global health challenge, affecting millions of people each year. This persistent disease is not just a medical issue but also a social and economic one, intertwined with various aspects of human life. To combat TB effectively, it is essential to explore its history, epidemiology, treatment advancements, community involvement, and the future direction of TB control efforts. The history of tuberculosis is marked by its presence in human populations for thousands of years, with evidence of the disease found in ancient Egyptian mummies. Initially referred to as consumption due to its characteristic symptom of wasting away, TB was often romanticized in literature and culture, masking the real devastation it caused. The development of the modern understanding of TB began in the 19th century, with the identification of Mycobacterium tuberculosis by Robert Koch in 1882, marking a pivotal moment in microbiology and medicine. This discovery laid the groundwork for subsequent advances in diagnosis and treatment, such as the use of sanatoriums in the early 20th century, where patients rested and received fresh air. Despite these advancements, TB persisted as a leading cause of death until the mid-20th century, when the introduction of antibiotics transformed the landscape of TB treatment and control. The epidemiology of TB reveals a complex interplay of factors influencing its spread and prevalence. Regions with high rates of TB often correlate with socioeconomic instability, limited access to healthcare, and high rates of comorbidities such as HIV, AIDS. In many developing countries, TB is endemic, with high incidence rates exacerbated by overcrowding, malnutrition, and poor living conditions. The WHO estimates that 1/4 of the world's population is infected with latent TB, highlighting the enormous reservoir of potential cases. In contrast, countries with robust healthcare systems, efficient screening programs, and public health interventions have seen significant declines in TB rates. Understanding these epidemiological trends is crucial for designing targeted interventions to control TB effectively, particularly in high-burden regions. Treatment advancements for TB have been remarkable, yet challenges persist. The standard treatment regimen consists of a combination of antibiotics that must be taken for an extended period, usually 6 to 9 months. However, ensuring adherence to this regimen is a significant challenge, particularly in low-resource settings where healthcare access may be limited. The emergence of drug-resistant strains of TB, particularly multi-drug-resistant TB, MDR-TB, and extensively drug-resistant TB, XDR-TB, complicates treatment protocols. These resistant forms require more expensive, less effective medications and a longer duration of treatment, often resulting in poorer outcomes. The global healthcare community is responding by investing in research for new drugs and treatment regimens, with a focus on shortening treatment duration and improving drug efficacy. Community involvement is paramount in the fight against TB. Engaging local populations in awareness campaigns can help combat stigma and misinformation surrounding the disease. Community health workers play a crucial role in educating individuals about TB symptoms, the importance of early diagnosis, and the necessity of completing treatment. Programs that incorporate peer support and local advocacy can empower affected individuals and their families, fostering an environment of understanding and support. Additionally, community-driven initiatives can facilitate access to healthcare services, ensuring that at-risk populations receive timely testing and treatment. By leveraging the strengths of local communities, public health efforts can become more effective and sustainable in combating TB. Looking to the future, the global response to TB must evolve to address the changing landscape of the disease. Innovations in technology, such as mobile health applications and telemedicine, can enhance patient engagement and adherence to treatment. These tools can provide reminders for medication intake, facilitate virtual consultations, and offer educational resources, especially in remote areas where access to healthcare may be limited. Furthermore, research into novel vaccines holds promise for reducing TB incidence, particularly among vulnerable populations. Global health initiatives that prioritize funding for TB research, diagnostics, and treatment will be essential for achieving the ambitious goals set by the WHO's End TB strategy. In summary, tuberculosis remains a multifaceted public health issue that requires a comprehensive and collaborative approach for effective management. By understanding its historical context, epidemiology, treatment challenges, and the importance of community involvement, we can devise targeted strategies to combat this ancient disease. The future of TB control lies in innovation, global collaboration, and a commitment to addressing the social determinants of health that perpetuate its spread. With sustained efforts, it is possible to envision a world where tuberculosis is no longer a threat to public health, but rather a manageable condition within a broader framework of healthcare excellence. Tuberculosis, TB, remains a significant public health concern, impacting millions globally despite advancements in medical science and public health initiatives. To fully understand the challenges of combating TB, it is essential to explore its pathophysiology, diagnostic advancements, global initiatives, the role of healthcare systems, and the importance of mental health support for patients undergoing treatment. The pathophysiology of TB involves a complex interaction between the bacterium Mycobacterium tuberculosis and the host's immune system. Upon inhalation, the bacteria can evade the immune response by multiplying within macrophages, a type of immune cell. This ability to survive and replicate in immune cells is a key factor in TB's persistence. In some individuals, the immune system successfully contains the bacteria, leading to latent TB infection, where the person remains asymptomatic and non-infectious. However, factors such as immunosuppression, stress, and underlying health conditions can trigger the progression of latent TB to active TB, where the individual exhibits symptoms and becomes contagious. Understanding these biological processes is critical for developing targeted interventions and treatment strategies to break the cycle of infection and transmission. Advancements in diagnostic tools have significantly improved TB detection and management, though challenges remain. Traditional methods, such as sputum smear microscopy, have limitations in sensitivity, particularly in patients with HIV or in children. The introduction of molecular diagnostics, such as the GeneXpert test, has revolutionized TB testing by providing rapid and accurate results, enabling timely treatment initiation. Furthermore, the development of interferon-gamma release assays, IGRAs, has improved the diagnosis of latent TB infection, allowing healthcare providers to identify individuals at risk of developing active disease. Despite these advancements, ensuring access to these diagnostic tools in low-resource settings remains a challenge, highlighting the need for continued investment in healthcare infrastructure and training for healthcare professionals. Global initiatives to combat TB have gained momentum, driven by organizations such as the World Health Organization, WHO, and various non-governmental organizations. The Global Fund to Fight AIDS, Tuberculosis, and Malaria, along with initiatives like the End TB Strategy, aims to mobilize resources and implement effective TB control measures. These initiatives emphasize the importance of a comprehensive approach, including improving healthcare access, enhancing laboratory capacity, and fostering community engagement. International collaborations are crucial for sharing best practices, resources, and research findings, enabling countries to learn from each other's experiences in managing TB. A focus on vulnerable populations, including refugees, migrants, and those living in poverty, is essential to ensure equitable access to prevention, diagnosis, and treatment services. The role of healthcare systems in managing TB is paramount, as effective control requires a well-functioning healthcare infrastructure. Integrating TB services into primary healthcare can improve access and streamline patient care, ensuring that individuals receive comprehensive treatment and support. Training healthcare workers to recognize TB symptoms and provide appropriate counseling can enhance early diagnosis and treatment initiation. Additionally, the implementation of electronic health records and data management systems can facilitate patient tracking and ensure continuity of care, particularly for those undergoing lengthy treatment regimens. Addressing gaps in healthcare systems will be critical to achieving the targets set by global initiatives and ensuring that no one is left behind in the fight against TB. Mental health support for patients undergoing TB treatment is often overlooked but is crucial for successful outcomes. The long duration of TB treatment, combined with the stigma associated with the disease, can lead to feelings of isolation, anxiety, and depression among patients. Addressing mental health needs through counseling, peer support groups, and access to mental health professionals can significantly improve treatment adherence and overall well-being. Integrating mental health services into TB care can foster a holistic approach, recognizing the interconnectedness of physical and mental health in the recovery process. By creating supportive environments for patients, healthcare providers can empower individuals to overcome the challenges associated with TB treatment and promote better health outcomes. In conclusion, tuberculosis remains a complex public health challenge that requires a multifaceted response. Understanding its pathophysiology, leveraging advancements in diagnostics, engaging in global initiatives, strengthening healthcare systems, and addressing mental health needs are all integral components of an effective TB control strategy. Through collaborative efforts and a commitment to equity in healthcare, the global community can work towards reducing the burden of TB, ultimately paving the way for a future where this ancient disease is no longer a threat to public health. The path to TB elimination demands innovation, compassion, and a shared vision of health for all, underscoring the importance of united action in the face of this enduring public health issue.